Dobrodošli. Danas ćemo govoriti o tome što možemo očekivati od COVID-19 u budućnosti. Govore nam Pfizerove stručnjakinje, doktora Monika Turiga, Vaccines Pipeline Medical Director International Development Markets, i dr. Sanda Horvat-Herceg, Senior Medical Advisor, Hospital Business Unit, Croatia and Bosnia and Herzegovina. So Dr. Monika Turiga, she will speak in English, and Dr. Sanda Horvat-Herceg will speak in Croatian. Dr. Monika Turiga, please welcome. Share your presentation. Thank you.
Hello. Yes, thank you very much. Hello, good afternoon, everyone. Thank you very much for the invitation. We are really honored to be here with you to share a few information about where this pandemic is going to and how can we prevent the burden of disease. So because the audience is general audience, so not doctors, I have to say from the beginning that my presentation will include only general information. I will not refer to a specific vaccine. It's only information that is available for the lay public, right? Because the communication for pharmaceutical companies is very strictly regulated, and I cannot share any specific information on a Pfizer product. So just to share my presentation. And I hope that my slides are visible right now. So I would like to share with you the importance of continued vaccination vigilance in the fight against COVID-19. And why? Because from the beginning, we were and we continue to be in it together. We were together in this fight against COVID-19, which poses a significant public health system. And Pfizer and BioNTech have emerged from the beginning as leaders in the mRNA platform. Why? Because the mRNA seems to be the appropriate solution, the appropriate platform, vaccine platform, to address in a rapid way a pandemic. This mRNA platform was studied even from 20 years ago, and it was observed that it's an efficient method, an efficient vaccination, and also safe vaccination. But the challenges that were associated with this mRNA platform were rather related to the lipid nanoparticles, so the vehicles that can deliver the mRNA inside the body. So why to choose this mRNA platform? Because it's able to induce a vaccine based on mRNA platform. It's able to induce a broad immune response with minimal risk of anti-vector immunity, and also enables boosting, right? What means? It means that it's able to induce immune memory. And then from the safety point of view, the mRNA vaccine, it's not infectious. It's chemically defined and contains no viral foreign proteins. And also it induced a rapid response. Why? Because also from the technology point of view, it enables a rapid development and quick production scaling. So the flexible mRNA platform has the ability to enable both boosters responses and rapid changes if needed to address a variant of concern. So from the beginning, you know, maybe that Pfizer and BioNTech vaccine was the first COVID vaccines licensed. And recently, we had also some new regulatory approvals. And here I listed the latest regulatory approvals, both in US, so by FDA, and also for the EMA, so the European countries. And I would mention that on the 12th of September, European Commission approved conditional marketing authorization for the Omicron-adapted vaccines against the variants BA4 and BA5, 5 for all people above 12 years of age. And also on 15th of September, EMA granted the full marketing authorization for the COVID-19 vaccines. So this means that it's no longer conditional marketing authorization, but it's a full approval for the original vaccine that was licensed. According to WHO, the pandemic is far from being over and will not be over anywhere until it's over everywhere. So the continued monitoring of the cases of COVID-19 is very important in all parts of the world. Why? Because we saw how rapidly it can spread a new variant from South Africa or from India or from Latin America. So it can very quickly spread around the globe. We have, unfortunately, more than 610 million cases around the world and over 6 million cases of death. And here we can see that a lot of countries have really huge burden of disease. What is the current epidemiology? We see that the number of cases, of COVID-19 cases worldwide is decreasing. But what we've seen in the last week, so the week of 26th of September up to the 2nd of October, we saw an increase by 8% in European region compared to the previous week. So pandemic is not over. And it's important to understand the variants, yes, because we are talking about the new variants of virus, the new variants of Omicron. What is the term of variant means? So it refers to viruses with genomes that have different molecular or genetic sequences, and they can differ even by one mutation or maybe more mutation. So from the ancestral strain, due to these mutations of the RNA, we can have variants that are really very far antigenically from the antigenic point of view compared to the ancestral strain. So when we look at the Omicron has more than 30 amino acid mutations. So it has a lot of mutations. And these mutations are really specific for RNA viruses. So the RNA viruses have a lot of mutations. It's not only specific to COVID, but to RNA viruses in general. What is also important to note in case of Omicron is that these mutations that occur are affecting the spike protein. So everyone heard probably about the spike protein, which is crucial for virus entry into the cells. And also the spike protein is crucial for the immunity that is induced by the current licensed vaccines, because all vaccines are targeting spike protein. So all the antibodies that are induced by the currently licensed vaccines are against the spike protein. Why? Because the antibodies that are against spike protein are neutralizing antibodies. So can simply neutralize the virus, can stop the virus to spread. And several COVID-19s that were developed against SARS-CoV-2 spike protein from the original strain were tested now to see the ability to protect against Omicron variants. And some characteristic of this Omicron variant is that it spreads more easily than the previous variants of SARS-CoV-2. The symptoms can be similar to those of previous variants, but the severity of the illness is milder. So Omicron infection may cause less severe disease than infection with prior variants, if we talk about Delta or Beta or Alpha. Also, some people may still have severe disease and may still require hospitalization, and we still see death occurring due to this variant. According to CDC, which is the Center of Disease Control and Prevention from United States, and which is a very well-established body in surveillance of the disease, stated that the current vaccines protect against severe illness, hospitalization, and death due to infection with the Omicron variant. However, breakthrough infections in people who are vaccinated are occurring. And also, Omicron has had some impact on the treatment available for COVID-19 because some monoclonal antibody therapies may be less effective against certain lineages. Non-monoclonal antibody treatments remain, fortunately, effective against this variant. What is the current landscape? When we look at the Omicron lineages, we see that the dominant one are now BA4 and BA5 lineages. So as of August, BA5 actually accounts for the largest proportion of infections, so more than 88.9%, and BA4 and BA4.6 variants accounting for almost all of the remaining infections. What is considering WHO for the future? WHO says that new vaccines may be needed to provide continued protection against COVID-19. Why? Because we saw decrease in the protection against infection offered by the current licensed vaccines that were developed against the ancestral, the original strain. Also, a pan-SARS-CoV-2 vaccine or pan-sarbecovirus vaccines, which can cover more viruses, more SARS-CoV viruses, or more sarbecoviruses, which is the subgenus of the coronavirus, where belongs also the SARS-CoV-2, may be needed, but the time frame for development is uncertain. So to have a universal vaccine would be much needed, but of course it requires a lot of time to develop such a vaccine that can address any variant. So it needs to target different parts of the virus. The available COVID-19 vaccines may need to be updated to offer better protection against antigenically distinct variants of concerns. And also vaccine-induced immunity using existing vaccines complemented by a booster dose of a variant vaccine may be valuable to broaden the immunological response. So WHO is stressing the importance of continuing vaccinating because the primary vaccination with the original vaccines boosted with variant-adapted vaccines can broaden the immune response against future variants of concerns that may occur in the future. And a few information about the development of the mRNA vaccine platform. How this mRNA vaccine works. So actually, the mRNA is embedded in lipid nanoparticles, which are injected into the body. Once it's injected into the body, the lipid nanoparticles are taken by the cells. And here we have a specific immune cell. Once it's taken this lipid nanoparticle, the mRNA enters into the cytoplasm of the cells. And here it's transcripted and forms a spike protein of the virus, which is expressed on the surface of our cells, of some of our cells. This spike protein is recognized by immune system that it's not a self protein, it's a foreign, right, protein, and then this vaccine stimulate an immune response that can be both by antibodies and also by cellular immunity, which means that some specific lymphocytes, CD4 positive and CD8 T lymphocytes, can kill the virus-infected cells and also can prevent severe COVID-19 cases. So this mRNA vaccines stimulates both types of immunity, humoral immunity, and also cellular immunity. I said from the beginning that the mRNA vaccines have the ability to be adapted quickly in case of emerging variants. And actually, it can be produced very quickly. It takes 1-2 days to produce the DNA templates and then another 1-2 days to produce the mRNA, right, itself, and then a few other days for the drug substance purification and concentration. Then a few more days for the lipid nanoparticle formulation and then the sterile filtration and quality control and release that might take the longer time, right? 4 to 5 weeks. So what is important, as I mentioned, that the RNA vaccines do not require a virus to be isolated, to be cultured on the cells. So the time to produce an mRNA vaccine is much shorter compared to other types of vaccines. So this is very useful in case of a pandemic to be able to react very fastly. What is the rationale to administer booster doses? So we saw all that SARS-CoV-2 virus has changed over the time, and we've seen several variants of concern: alpha variant, also beta variant, delta, gamma, and later on, since November 2021, since was the first time identified, the Omicron, which evolved further on with several sublineages, as I mentioned before. And now we are seeing mostly BA4 and BA5 lineages. So why we need booster against Omicron? Because the Omicron is significantly more transmissible than prior variants. In adult populations, 2 doses of the current mRNA COVID-19 vaccines do not adequately neutralize the Omicron. So it was seen that a third dose increases the breadth of coverage and can neutralize the Omicron. The real-world data show that a third dose significantly improves protection against Omicron-related symptomatic disease and severe disease, especially severe disease and hospitalization and death. Although receiving a booster, the third dose, substantially improves the vaccine effectiveness against the Omicron variant over the primary series, we've seen the waning of protection over time. So the vaccine effectiveness wanes, especially against symptomatic disease and infection, underscoring the continuing need for effective vaccines against these emergent variants. I put here some data to show the impact of the vaccination in United States. In this graph, we have for all mRNA vaccines, so it's nothing specific for any specific vaccine, so it's all mRNA vaccine. And we can see that both in Omicron, when Omicron started, and also during Delta, during previous period, we see that fully vaccinated people with booster, including booster, had less chances to have disease, right? Compared to have hospitalization compared to people who received only primary vaccination, right? So we have here primary vaccination, people with booster, and unvaccinated people. So we see that the vaccinated people, either with primary and also with the booster, they were less likely to be hospitalized, either during Delta, either during Omicron time. So significant impact of the vaccination programs. And in the end, I would like to give you a few ideas, let's say, about where Pfizer is going further. So what we are doing now, we are testing different versions of the COVID-19 vaccines against Omicron, so Omicron modified vaccines. We are also evaluating a next generation vaccine to be able to protect even more against variants of concern. And we are working on potential next generation oral treatments. Also, we are developing and using the mRNA platform for other therapeutic areas, and we are working together with the governments, with healthcare providers, and also with patients to help prevent the burden of disease for COVID-19. As I mentioned, we are investing a lot in this mRNA platform, and we are also developing vaccines against other infectious diseases, such as influenza, such as shingles, and also we are applying this technology in rare disease and also in oncology, but also in inflammation and immunology and internal medicine. So we want to maximize the rapid development of the mRNA and also all the benefits that I mentioned to help protect different patients for different pathologies. And with this, I thank you for your attention, and I will give the floor to my colleague, Dr. Sanda Herzeg, to talk about oral prevention or oral treatment of COVID-19. Thank you.
Thank you, Monica, for this great presentation. I believe this is a really good insight in the topic on which you were talking now. And now I will switch in Croatian. Dobar dan. Pozdravljam sve skupa vas prisutne i zaista vam zahvaljujem što imamo priliku biti današnji gosti ovog panela. Ja sam doktorica Sanda Horvat Herzeg i dolazim iz medicinskog odjela tvrtke Pfizer u Hrvatskoj, a moja tema danas su izazovi i terapijske mogućnosti COVID-19. Kolegica Monika je već mnogo govorila o samom SARS-CoV-2 virusu, ali ja ću vas podsjetiti da je Svjetska zdravstvena organizacija službeno proglasila novu zaraznu bolest nazvanu COVID-19 u veljači 2020. godine, a u ožujku 2020. godine je Svjetska zdravstvena organizacija proglasila globalnu pandemiju. Sam naziv COVID-19 jest akronim koji dolazi od naziva korona, virus, the disease 2019 godine, dakle godine prve dijagnoze SARS-CoV-19. Kakva je situacija u Hrvatskoj? Dakle, kolegica je već prije mene naglasila da je Svjetska zdravstvena organizacija rekla da je da smo jako daleko od samog kraja pandemije i da se taj točan tijek pandemije ne može predvidjeti. U Hrvatskoj su trenutno ukinute mnoge epidemiološke mjere. Imamo smanjen broj hospitaliziranih bolesnika i broj smrtnih slučajeva. Ipak postoji vjerovanje da omikron i nove varijante koronavirusa nisu opasne zato što izazivaju nešto blaže simptome i da su zapravo one manje opasne od prethodnih, tako se to vjeruje. Isto tako, trenutno većina bolesnika ima blaže simptome i često se ne obraća zdravstvenom sustavu za pomoć, nego se primjenjuju mjere samoliječenja. Postoji i određen broj bolesnika koji se liječnicima javljaju tek nakon pojave jačih simptoma, tako da je to onda u podmakloj fazi bolesti COVID-19. S obzirom da je moja prezentacija danas koncipirana za opću javnost, onda ću vam zapravo i reći poruke za opću javnost i što bi zapravo trebalo činiti. Dakle, svakako treba promovirati mjere odgovornog ponašanja, epidemiološke mjere i preporuka je da se pacijenti jave svom liječniku obiteljske medicine odmah nakon pojave prvih znakova bolesti COVID-19. U slučaju pojave simptoma COVID-19 i pozitivnog kućnog testa na COVID-19 svom se liječniku obiteljske medicine treba odmah obratiti. Mjere cijepljenja protiv COVID-19 treba i nadalje promovirati. Dakle, cijepljenje ostaje i dalje jedna od ključnih stvari kako bi se ta bolest mogla kontrolirati i prevenirati. A širu javnost treba upoznati sa učincima liječenja COVID-19 i to koje su dostupne antivirusne terapije, odnosno kakva je uloga peroralnih antivirusnih lijekova. Ukoliko pacijent ima znakove kao što su povišena tjelesna temperatura, grlobolja, kašalj, poteškoće disanja, gubitak njuha ili okusa, to se može dakle raditi o bilo kojoj akutnoj respiratornoj bolesti, a isto tako to se može raditi i o COVID-19. U tom slučaju su preporuke Hrvatskog zavoda za javno zdravstvo da se u slučaju pojave takvih simptoma obrate svom liječniku obiteljske medicine koji će im izdati uputnicu za testiranje i dogovoriti termin testiranja, odnosno u slučaju težeg oblika bolesti, ako to zahtjeva liječenje u bolnici, da se izdaje mu se uputnica za bolničko liječenje. Ovo je po meni iznimno važan slajd koji nam kaže da je Hrvatsko ministarstvo zdravstva zapravo već izdalo smjernice da se u svrhu liječenja blažih do srednje teških oblika COVID-19 može dakle ta terapija primijeniti ako pacijenti imaju jedan ili više uključujućih medicinskih stanja o kojima ću sad nešto reći. Znači, ako se radi o populaciji od 65 ili iznad 65 godina, nije potreban dodatni kriterij, a kod populacije od 18 do 64 godine, dakle, potrebna je takva terapija ako imaju body mass indeks veći od 35 kg po metru kvadratnom, dakle ako su pretili, ukoliko imaju povišeni arterijski tlak, ako imaju nekakvu kardiovaskularnu bolest, ako imaju kroničnu opstruktivnu plućnu bolest, ako imaju drugu kroničnu respiratornu bolest, ako imaju kroničnu bolest bubrega, šećernu bolest, imunosupresivnu bolest ili ako uzimaju aktualnu imunosupresivnu terapiju. Znači, već u siječnju ove godine je Europska agencija za lijekove EMA odobrila peroralni lijek tvrtke Pfizer upravo za ovu skupinu bolesnika o kojima sam malo prije govorila. Dakle, odrasle osobe koje su ugrožene od razvoja težeg oblika bolesti COVID-19. Takve se osobe mogu liječiti ambulantno i zbog toga im je dostupna peroralna terapija. Ovaj slajd sam izdvojila zbog toga da zapravo ukažem kakav je taj životni ciklus virusa SARS-CoV-2. Naime, već je kolegica govorila kako SARS-CoV-2 virus ulazi u stanicu preko ovoga šiljka ili ti spike proteina. Taj virus se nakon toga, dakle oslobađa se virusni genom i u procesu translacije proteolize dolazi do replikacije, odnosno umnožavanje virusnih čestica. Da bi se te virusne čestice mogle umnožiti, potreban je prvenstveno ovaj proces proteolize, dakle gdje se ovi poliproteini rastavljaju na razne sastavne dijelove i da bi mogli nastati novi virusi, virusne čestice. Ako je taj proces blokiran, onda ne mogu nastati novi virusi. I to je upravo mjesto u stanici gdje djeluje taj Pfizerov peroralni lijek za liječenje, za razliku od cjepiva o kojima je pričala kolegica, koji djeluju na površini stanice i na ovom takozvanom AC2 ili ACE2 receptoru. Važno je isto tako naglasiti da i Svjetska zdravstvena organizacija preporuča peroralni Pfizerov lijek kao prvi izbor liječenja upravo kod ovih bolesnika, znači kod blažih do srednje teških oblika COVID-19 koji imaju jedan ili više rizičnih medicinskih stanja ili su stariji od 65 godina jer kod njih postoji visok rizik hospitalizacije ili smrti. Isto tako i Europska regulatorna agencija je uključila taj lijek među 10 ključnih lijekova za kontrolu i prevenciju COVID-19. Koje bi bile, dakle, na kraju ključne preporuke i moje preporuke za vas u ovoj prezentaciji? Prvo, da se poštuju mjere prevencije. Dakle, građane treba podsjećati na poštivanje svih epidemioloških mjera, ali opet naglašavam važnost cijepljenja o kojem smo već danas pričali. Drugo, ranim postavljanjem dijagnoze se mogu spriječiti komplikacije COVID-19. Dakle, treba potaknuti građane da se već nakon pojave prvih simptoma bolesti pravovremeno jave svom liječniku obiteljske medicine da bi mu se napravio BAT ili brzi antigenski test, da bi se on testirao, da bi se potvrdila dijagnoza bolesti i da bi, ovisno o rizičnim čimbenicima, mogao dobiti potrebnu terapiju. Dakle, jako je važno da se na vrijeme obratimo svome liječniku kako bi se liječenje moglo započeti na vrijeme. I važno je znati da je peroralna antivirusna terapija visoko učinkovita, ali se mora primijeniti unutar 3 do 5 dana od pojave prvih simptoma bolesti. Osim toga, bolest može imati nepredvidiv tijek i to je posebno izraženo kod bolesnika koji imaju pridružene ili kronične bolesti, odnosno kod starijih osoba. Ovo su slike iz Pfizerove planirane kampanje za uvođenje, dakle, važnosti svijesti o tome kako se može kako se mogu prevenirati neželjeni ishodi COVID-19. Znači, da se poštuju mjere prevencije, da se na vrijeme obratimo svom liječniku, da se dijagnoza rano postavi kako bi spriječile komplikacije i da se pravovremenim liječenjem zapravo spriječe neželjeni ishodi. Hvala na vašem vremenu i raspoloživi smo za pitanja i raspravu.
Hvala doktorice Sandra. Thank you, Dr. Monica. So I invite everybody now, if you'd like to ask some questions, the time is now. If not, in the meantime, I would like to ask Dr. Monica, how about the difference of vaccines which provide long life protection and COVID-19 vaccines? Is it possible that in some time we get one vaccine for COVID and that's it?
Well, thank you very much. It's a very good question. It's an interesting question that, of course, I think that everyone is thinking about. So, yeah, it's true that there are some infections or vaccines that can provide lifelong protection. Unfortunately, this is not the case with COVID infections or COVID vaccines. Why is that? Let's think, for example, at measles, right? We have only one time measles, and then we are protected for all our life. And we have vaccination when we are children, and then the protection lasts long. The same for varicella. Why is this, right? Because the incubation period for measles and for varicella is very long. So when the virus gets into the body, it takes quite long to replicate and to infect cells. It's time for our immune memory to recognize the virus and to stimulate production of antibodies that can destroy the virus. Unfortunately, SARS-CoV-2 has very short incubation period right now. When we saw that the incubation period is 2 to 3 days, right, up to 72 hours. So basically, it replicates very fast once it's entered in our respiratory tract, so in the nose, and it's replicating so fast that our immune system has no time to react so quickly to stop the infection at the upper respiratory tract. But fortunately, it is time to develop new antibodies and to prevent the spread to lungs and to prevent severe disease. That's why we see that protection against severe disease, against hospitalization, it's still lasting, right? But we see a decline in the protection against symptomatic disease, right? Like having sore throat, having fever, having runny nose, and so on. So because of this very fast replication once it's infecting us, you know. So at least this is a part of the explanation that also the World Health Organization is providing.
Thank you, Dr. Monica. And how about oral vaccination for people who don't like needles? Is it possible in the future?
Oral vaccination, there are no vaccines orally administered, but yeah, there are some vaccines in development that are intranasal administration. Okay. But there are still in development, so we don't see any data for these vaccines. Orally, personally, I don't think so, because our digestive, enzymes can destroy the vaccine before getting some immune response. But for intranasal vaccines, we need to see. But maybe other oral treatments for COVID. Yes.
And how about combination of COVID-19 vaccination with flu vaccination? Is it possible?
Yes, there are companies working on such combined combo vaccines. It depends a lot on the future epidemiology. We need to see if COVID is here to stay for a longer time, and to prevent both influenza and both COVID will be possible. So such combo vaccines are now in development. But now we are at the beginning of the cold seasons, and what we've seen in the southern hemisphere, in Australia and in Brazil, we've seen a very bad influenza season. So we need to be careful and to be aware and to protect against influenza. There are available vaccines against influenza, and especially the most vulnerable population needs to be protected.
So I ask participants once more, would you like to ask some questions? Any comments? Please feel free.
I do have one question for Monica. Should we be afraid of these new vaccines?
Well, thank you for the question, Sandra. No, we shouldn't be afraid of these new vaccines. So basically, all these adapted vaccines are based on the platform, the same platform used for the original developed vaccines that are now used for more than 2 years. And what is changed in the new adapted vaccines is just a sequence of the mRNA, messenger RNA, that encodes now, this time, encodes also the spike protein from the Omicron. So basically the new adapted vaccines are bivalent vaccines, then can protect also against the original strain and also against the new variants of concern, right? Because what we've seen so far was that the vaccines against the original strain still protect very good against severe disease, against death, hospitalization. So that's why WHO and other regulatory bodies have decided that it's better to continue to protect against ancestral, so original strain, and also to provide additional protection targeting the new variants of concern. So the bivalent vaccines use the same platform.
Thank you.
Thank you.
So as we do not have questions, hvala svima na vašem sudjelovanju. Hvala doktorici Moniki. Thank you, Dr. Monica. Hvala doktorici Sandi na vrlo iscrpnim prezentacijama. Kao što sam spomenula, ovu snimku možete pogledati od sutra na našim web stranicama ili na YouTube kanalu AmCham Croatia. Pozivam vas da nam se pridružite na našim ostalim događanjima koji su objavljeni na našim web stranicama i objavljamo isto tako u newsletteru kojeg šaljemo 2 puta mjesečno. Hvala još jednom svima na sudjelovanju. Želim vam ugodan ostatak dana i srdačan pozdrav svima.
Hvala vama.
Thank you.
Bye bye, thank you.
Bye bye.
Doviđenja.
Hvala, pozdrav.
Bye bye, thank you.
Hvala Bog.